Welcome once again to the Solve Wounds channel. Today we'll be talking about frequently asked questions about wounds. And I have a few questions here that I will want to answer very briefly. How long will it take my wounds to heal? Naturally, if you have what we call an acute wound that is not very big in terms of size, the wound should heal within a 2 to 3 week period, what we call revitalization of the wound. However, if that wound is very large, then the wound will need some help in healing. Sometimes you may need to have what you call a surgery, which may be called a skin graft, taking some skin from one part of the body to cover that aspect, or what they sometimes will call a flap, taking some tissue, more than the skin, maybe even the muscles and what is underneath the skin, moving to that area to be able to cover that particular wound. However, if a wound has gone beyond what you call the acute stage and you have what you call a chronic wound, a wound that is going beyond 3 weeks, 4 weeks, particularly going to 6 weeks, those wounds, if not properly taken care of, may take a long time to heal, and you need specialist care for that. It's generally believed that within a 12-week period, about 50% of what you call a difficult to heal wound should have reduced by 50% of the size. So you can see that sometimes it takes a long time for what you call chronic wounds to heal, even in the best of centers. Number 2, how can I prevent my wounds from getting soaked in the shower? That's a very practical question. What you need to do is to find a waterproof nylon to cover the wounds while you are having your shower. That will prevent the wounds from getting soaked while in the shower. Number 3, what is my role in wound healing? Well, your role in wound healing are numerous. One of the most important roles that you have in wound healing is taking care of the wound properly. Taking care of the wound properly means that you attend to the wound as at when due. This would include, 1, either going to the hospital so that you are put on what you call a wound care plan. A wound care plan will mean going to the hospital to ensure that your wounds are dressed, ensuring that you have either tetanus toxoid taken. In some instances, you may need to have some form of painkillers, what we call analgesics. You may need to have some antibiotics done, or even have some investigations done, particularly before you are given the antibiotics. You may also need to have some form of surgery in order to encourage the wounds to heal, which may be what you call a skin graft, taking some skin from that one part of the body to cover that area, or a kind of flap surgery, taking more than the skin and the things that muscles underneath the skin to be able to cover the area. Sometimes you may need to have what is called a compression therapy done, and you may need to have a combination of all this. Also, you may need to eat very well and also have some nutrients as supplements to encourage the wounds to heal. So your role is actually adhering to that wound care plan to ensure that your wound heals as fast as possible. Subscribe to the Solve Wounds channel to learn more about wounds.